Hello, my name is Ruby Parrish,
My name is Paula Sunga.
I'm Shanali Pathirana.
and this is our project for KIN537, Movements for Individuals with Severe Disabilities. This project is pertaining to a visual impairment and making a physical education program for them. A visual impairment pertains to a person having less than average eyesight, which affects multiple aspects of everyday life. Subtypes refer to a person's vision for which there is not a continuum because blindness is different for every individual. Subgenres include blindness, central and peripheral vision loss, and impairment after correction, for which all three of us use glasses and contacts. So, more commonly known as nearsightedness, myopia is when a person's retina only picks up light off of close-up objects, which is shown here as peripheral vision loss. Alternatively, farsightedness, or hypermetropia, only allows the retina to pick up light off of objects that are far away. Since I mentioned there are many ways a person's visual impairment affects their vision, and color blindness also comes in many different types. One person may be able to distinguish most colors except red and green, and another only sees varying degrees of gray. One fun fact is that color blindness affects the male population more. As for a visual impairment following a traumatic injury, visual issues often stem from a damaged information processing part of the brain called the primary cerebral cortex.
Along with visual impairments, they can also experience conditions like poor psychological health, social isolation, and reduced quality of life. These individuals are also more prone to falls, fractures, and injuries. These are causes of restricted independence, mobility, and educational achievements. Familiarity is key for individuals with visual impairments. They use their other senses like hearing and touch to help guide them. Another helpful guide they can use for assistance is service animals who can be their eyes in unfamiliar places. Using canes can also help in assisting to prevent falling, tripping, or bumping into things. Accessibility features in public that are helpful are like announcements and guides. Speaking of guides, health and safety considerations in physical education and in fitness settings are one of the main accommodations to ensure their safety. As a PE teacher, it is key to getting to know each of the students' need for better understanding. Allow them to place themselves in areas where they will be participating so they could familiarize themselves, because remember, familiarity is key. Having little to no clutter in those areas, especially having things off the floor to prevent them from falling. Using bells, guide ropes, and enforcing a buddy system just in case the students need further assistance. In fitness settings, depending on the severity of their impairment, many equipment can be used like free weights or machines. Things like guide ropes or wire, like in these two pictures of a man bowling and a little girl running, are examples of guide ropes, and sighted guide or a collar for assistance, and machines that are safe to use are machines like treadmills or stationary bikes.
So this is health and safety considerations that take place in clinical settings like physical and occupational therapy sites. So the first one is clear communication. It's really important to use descriptive language to avoid any confusion, provide helpful feedback, and just avoid any uncertainties or worries that the patient might have. It's also important to have a safe environment. So like Paula said before, this includes clear pathways, avoiding clutter, even in flat floors, and even things like rugs can be disturbing, and avoid slippery surfaces. And there's something called guided exploration, which is when a patient has free roam of the clinic. Obviously, they are led by the physical therapist, occupational therapist, whoever's there. They are led by them, but it gives them free range to get familiar to the area because familiarity is key. Adapted equipment, there's a lot of things that you can use, like high contrast colors in case they're not completely blind, it's partial blindness. And there's also other equipment that uses other senses like touch and hearing. And there's also body awareness exercises. Those are important to understand how manipulation works, object manipulation, for example, one cup of water into another, just so they can get a feel of the cup, the weight of the water, things like that. And there's also something called PNF, which is proprioceptive neuromuscular facilitation. That's basically contracting and relaxing your muscles. Okay, patient education encourages advocacy as it gives the patient more control over their treatment and it lets them know the benefits of certain exercises. And when patients know the benefits of certain exercises and how exactly they're beneficial, they're more inclined to participate in the exercises. And so next we have instructional strategies that include fall prevention. So there's 3 different factors you could do. Environmental modifications like tactile stairs, that includes things, different textures. So you could have like rubber and then a hard pad. And then so that would work. Again, cleared pathways and contrasting colors, like on a sidewalk, there will be black and yellow lines to let them know. And another one is balance training. That's a really important one. You can do balance board, a tandem walk, which is basically a tightrope walk, and a flamingo, which is balancing on one leg. And then you can do precautionary techniques, which is basically teaching yourself how to fall safely. So there are a few things that you can do. You can tuck your chin in. You would slide your palms out and have them slide instead of slapping the floor to decrease the impact, and getting as low to the floor as possible. So squatting down or lunging forward, however that can be. We also have assistive technology. A lot of these are apps, programs. So we have a voice assist that's Amazon Alexa, Google Assistant, and Apple Siri. We know those ones, we're familiar with those ones. There's also one's public assistant where there will be visual interpreters for you. There's Be My Eyes, which is an online community where volunteers can get videos, photos, and live feeds from people asking for assistance. Ira uses video calls with visual interpreters to assist with things like navigation, descriptions, and other things. And there's TapTapSee, which is image recognition, is used as it's used to describe pictures taken from a user's phone. And then we have navigation. There are 3 apps, Blind Square, Microsoft Soundscape, and Ariadne GPS. Blind Square is a navigation tool that can be used both inside and outside. It allows for voice commands and even recommends popular places. And it's utilized while other apps are still in use, so you can still hear the navigation and the directions while you're on a phone call, while you're on social media, anything else. And then there's instructional strategies for ADL training. ADL stands for Activities of Daily Living. This is more so in the occupational field, as it's teaching them to live their lives as they are. So the first one is hygiene. You can label your toiletries. You can use electric razors that have the safety guard and a systematic routine. So knowing what to do first, like making a routine of washing your hair first, your face, your body, your legs, and going down the list like that. And for meals, again, familiarity is key. So know the layout of the kitchen. There's accessible supplies like different types of knives, measuring bowls, and even some measuring spoons that'll beep if it gets to a certain level. And then practice without power means practice while appliances are off. So practice opening your oven, putting a tray in when the oven is off, so you know what to do when it's on and you're familiar with it without the dangers of a hot oven. And then there's transferring, which is just going from place to place. So having a chair next to your bed allows for easier access to go from standing to laying horizontal as you're doing it in increments. And then handrails to a seat, you can use those for support. And there's also things like landmarks, which is you can use like colorful stickers to identify where things are and identify where you're walking.
This YouTube video provides an insight into how a program for people with visual impairments is inclusive and beneficial for all, regardless of how blindness affects them.
Every Friday, a group of men, women, and dogs meet in the Jack Purcell Community Center for a fitness program designed for blind and visually impaired Ottawans. Shelley Ann Morris has been participating in the classes since their inception.
Everyone here, every participant, is at a different level, both in fitness and in terms of the vision that they have. Some people here are totally blind, while others, like me, have fairly good vision.
Because we can't all see the instructor, the volunteers help us to manipulate our body into the position or describe to us what the instructor's doing. You know, when you're exercising, you build confidence in yourself. For the second year, I'm running the Boston Marathon in April. Again, with the help of people like George, he ran California Marathon with me.
2 years ago.
2 years ago in December 2012. So I'm always pushing myself.
Good job, and take it away.
If somebody is losing vision, they might feel that they can no longer do what they used to like to do. They might be afraid that, you know, that the place that they want to go won't accept them. They might be afraid that they'll get into a health facility, not know their way around, or trip on something, or have an accident maybe. All those fears I had when I first started, and now I can participate virtually like everybody else.
As a refresher, visual impairment affects every individual differently. Either an innate or acquired quality affects multiple aspects of everyday life. This includes nearsightedness, farsightedness, central and peripheral vision loss, and colorblindness. Fun fact is that depending on the situation, a visual impairment can classify as a disability. For example, people who are colorblind often do not pass the state-mandated driving test.
Individuals with visual impairment can experience or be more at risk of other conditions. So when working with these individuals, it is essential to know how to ensure their safety. They should know the proper methods so people with visual impairments can participate while still being safe. There are various safe methods, not just one way, but multiple variations, like using guides and using alternative machines.
Clinical settings are safe spaces, which is why precautions are super imperative when it comes to the care and well-being of those with visual impairments. Patient education is also necessary when it comes to therapies, as it gives the individuals a deeper understanding of the what, whys, hows, and how to deal with potential hazards outside of the clinic.
Here is a list of our references, and I hope you guys enjoyed our presentation.
Thank you.
Thank you.